Well, my friends, this is a not new to us, not new in medical science, but new to us. আমাদের কাছে নতুন and a very critical case of this patient is about only 34 years, has come from Guwahati of Assam. The case is very serious, so serious that the Narayana Hospital, one of the excellent center for the cardiological cases, have clearly declared that only heart transplant will result in improvement. Heart transplant is the only definitive treatment at these stages. So you have understood how serious this case. ভদ্রলোকের হার্ট পুরো বাদ দিতে চেয়েছে, হার্টের কাজকর্ম ব্যাহত হচ্ছে, ডিস্টার্ব হচ্ছে। কারণটা কি? তার জন্য ওনার নানান রকম সমস্যা দেখা দিচ্ছে। হি হ্যাজ ডেভেলপড মেনি কমপ্লেন্টস, অ্যাবডোমিনাল ডিস্টেনশন, অ্যাবডোমেন সোয়েলিং, abdominal discomfortness, back pain, difficulty in breathing, fatigue, and ascites, and pericardial effusion. That means the fluid inside the pericardial cavity, the cavity where the heart lies, and also fluid inside the pleural cavity, the cavity where two lungs lies. So pericardial effusion, pleural effusion, peritoneal effusion, that is known as ascites, due to disturbances of the cardiological functions. Cardiac myopathy, the cardiomyopathy. So this is a case of cardiac myopathy or cardiomyopathy. It started with palpitation. See, this is the note of the allopathic hospital. It started with palpitations in 2016 and 2017. At that time, there was atrial tachycardia, tachyarrhythmia, left ventricular apical thickening, and cardiac sarcoidosis, which was treated with steroids. Now, sarcoidosis and amyloidosis is the main cause of his enlargement of the heart, dysfunctioning of the heart. Sarcoidosis and amyloidosis. In the past history, we have also seen from the Mahajan Imaging Center, there was amyloidosis and sarcoidosis. Now, what is sarcoidosis? Sarcoidosis is a disease characterized by the growth of tiny collections of inflammatory cells, some granulomatous cells in any part of the body. It may deposit in any parts of the body, most commonly in the lungs and the lymph nodes. But it can also affect the eyes, the skin, the heart, and other organs. In this subject, these granulomas or sarcoidosis is deposited in the heart. The cause of sarcoidosis is unknown, but experts think it results from the body's immune system responding to an unknown substance, so idiopathic. Some research suggests that infectious agents, some chemicals, some dust and potential abnormal reaction to the body's own proteins could be responsible for formation of such granulomas. In people who are genetically predisposed. So there is no cure for sarcoidosis, but most people do very well with no treatment or only modest treatment. But in some cases, sarcoidosis goes away on its own and may disturb the functions of the heart, lungs, or wherever it deposits. In this patient, it has grossly deposited within the heart, and this is caused due to sarcoidosis of the heart. Now, he has also suffered from amyloidosis in the past. What is amyloidosis? It is a rare disease that occurs when a protein called amyloid, the name of the protein is amyloid. The amyloid builds up in organs. These amyloid build up can make the organs and not work properly. So the amyloids also deposits in the different organs of the body, in the heart, in kidney, in liver, in spleen, and also in the nervous system and digestive systems. Some types of amyloidosis occur with our diseases. These types may improve the treatment, but this patient developed amyloidosis and sarcoidosis. As a result, the heart is totally dysfunctioning, and for which they have suggested to remove the heart, and replaced treatment is essential. But it is not a matter of joke. It is very easy to say, but it is very hard to do. The result, they have clearly told, patient has advanced cardiomyopathy, which is unlikely to recover. I had an extensive discussion with the patient. I have discussed the patient's prognosis at this stage and that a heart transplant is the only definitive treatment at this stage. Only heart transplant will result in improvement of the only definitive treatment at this stage. So this is a critical, this is severe, this is thinkable case of the patient, and that's why they have come from the Guwahati of Assam to consult with me. Now, what will be our approach of treatment? What will be my selection in homeopathy? This is a purely psychotic phenomenon because there is abnormal secretions of the amyloids and sarcoids. So, abnormal production is always in favor of psychosis. So, there is psychotic dyscrasia in the past of the patient since long. Number two, I have observed there are numbers of moles all over the face and here and there. Number of moles, smaller moles are found in this patient. So definitely the patient is psychotic and on antipsychotic medicine to be given. Now considering the antipsychotic medicines, the symptoms, I do like to prescribe T. occidentalis considering the other symptoms. There is profuse perspiration, ascites is developed, hypersensitiveness, clear weather aggravates, all symptoms go in favor of T. occidentalis. So I do like to prescribe T. occidentalis in 50 millisiemens scale of potencies, and let's see the result. I shall share you the result of the case of this patient, my friends, afterwards.